welcome everybody. Please remember to keep your microphones muted, and any questions you have, please put them in the chat and I'll ask them at the end of the presentation. And with that, Dr. Jobin, go ahead and take it away.
Great. Well, thank you everybody for joining me today as we are going to discuss Martian mental health. And as you can see on our slide's subtitle, I'm going to share with you a little bit about how this COVID-19 pandemic seems to have accidentally set the stage for psychotherapists to perform their duties with folks that are hurting and far away, such as astronauts will be, and our future Martians will be. So real quick, I just want to introduce myself to you. I'm Dr. Jim Jobin. I'm an actual practicing psychotherapist and addictions counselor here in Las Vegas, Nevada. I'm also the president of the Nevada Counseling Association. So I'm not coming to you today as somebody who has done advanced research into the psychology of astronauts. I'm coming to you today as an actual clinician, somebody who works with those who are experiencing crises and problems in their mental health or just in their relationships or regular life, and who actually is about the business of helping them and trying to help them be successful and to heal. Also, just as an FYI, if you're already part of the Mars Slack, you can go to the hashtag mental health. There's a section in there to discuss all things psychology, and we'd love to have questions asked in there too. And as our volunteer just said with you, and I want to reiterate, as I'm talking today, please feel free to use the chat and please type in questions. I'm really going to try to budget time to make sure that we get some questions answered, and there might be an opportunity or two to discuss something more in depth. So we want to make sure that we're taking that chance to do that. So what are we going to talk about today? I want to talk about how COVID-19 actually ended up simulating the circumstances that are going to be similar for Mars travelers. Earlier today, we heard about chamber experiments, and we heard about these very small sample sizes we have of humans who are going through similar conditions to Martians. The pandemic actually greatly increased our sample size of humans going through unique stressors and gave us an opportunity to study that. And so I want to share why I think that's relevant. We're also going to talk about how COVID-19 changed what I do for a living. As a practicing psychotherapist and my colleagues and community, this disease fundamentally changed what we do. And unlike other healthcare professions, we actually are finely attenuated to interacting with human beings. And so trying to do this in a new way fundamentally changed some things for us. And I'm actually going to show you and explain a little bit about how therapists actually changed how we do our jobs to make a difference. We're going to talk about how that's actually going to relate to our Martian pioneers as well. And then lastly, as I just said, we're going to talk a little bit about how psychotherapists actually changed things in the way we do our trade, which I think you'll find relevant. So first, let's discuss how this COVID-19 pandemic actually made it a larger sample size of humans to study. So here in this global pandemic, we have had unique circumstances that are affecting everybody. And if you think about it, it's similar enough to what it's going to be like to be an astronaut or to be a Martian pioneer. We have indefinite social isolation, just like how Martians are going to be in the hab and they can't leave the hab and they're very confined. Many of us haven't left our bubble. I'm practicing now from my home office. I barely leave this house. Groceries are delivered. We don't go out into the world anymore. Don't go out into the sun or the parks or the malls anymore. Martians are going to have that in common with us. A lot of humans were afraid for the first time in a long time, or the first time ever in many of their cases, of death. Mortal danger was upon us. And as we all checked our doom scrolling Twitter feeds, we saw how dangerous this pandemic was, and there was a lot of uncertainty there. We also have this in common with our Martian future pioneers, that we became entirely dependent on technology for our regular interactions and our regular communications. That's a big deal because this is going to parlay into the way that psychotherapists are going to have to help these folks as well. More things that we have in common with our future space pioneers. We were all trapped. Many of us joke about our new colleagues, which is our children or pets or spouse. We're spending all this time with just a small number of humans that are in our bubble. Whether those are close colleagues, friends, or family, that's similar to what it's going to be like to be on Mars. And this cannot be understated, this final point. The uncertainty that we've all felt during this time is hugely relevant to what it's going to be like for the future. So COVID-19 gave us all new circumstances. How did it change the way that therapists like me do our jobs? This is a graph that shows you a poll done by the American Psychological Association. Look all the way down to the bottom of that graph. 1% of therapists treated their patients remotely before the pandemic. There's a reason for that. Our skills are finely tuned, and we train for years to be able to interact with humans, to read subtle body languages, to notice the way they're breathing in the room, and to pair and partner with them to try to get some results. Only 1% of us were doing telehealth before the pandemic. And look at that top bar. 75% of us not only doing telehealth, doing everything via telehealth. The way I'm talking to you today is the same way that I meet with my patients all week long. I'm one of the therapists in that top bar. All of my work now is done via telehealth. This is important because we are a field that did no telehealth prior to the pandemic. And now 3/4 of us are doing exclusively telehealth. That means that my trade, my colleagues and I, we had to change the way we do our very delicate healthcare discipline to be able to do it this way, which I think is ultimately going to benefit Martian pioneers down the road. So 3/4 of us therapists had to change the way that we do therapy. And I'm going to teach you a little bit of inside baseball. Again, I'm not a researcher, I'm a practicing healthcare provider. What kinds of things did we therapists have to change in order to help real people, especially people going through all those pandemic qualities that we were talking about earlier? Therapists do something called attending, which is clinical speak for actually connecting with human beings and putting them at ease. See, there's a lot that goes into that training to make sure that what you're saying and how you're saying it and the way you're interacting elicits and causes calmness in another human being. You can see a little acronym in those bullet points there. We call it SOLAR. And so therapists are trained to sit comfortably, as you can see in the picture that therapist there is modeling that behavior. We try to have an open posture. We don't like to cross our legs or cross our arms because that communicates that we're disinterested or we're closed off to you. We tend to lean forward with interest from time to time to try to compel you toward us, metaphorically, to share more. We try to use effective eye contact, and we try to stay relatively relaxed. How the heck do you do all that whenever you're trying to translate those personal skills into the digital environment? Therapists had to learn how. Notice that little picture there. You see those googly eyes that are glued to that little Logitech webcam? That's exactly what's happening on my webcam right now. You'll notice that as I'm talking today, I seem to be looking you in the eye. That's because I have little googly eyes on my camera, because as a therapist, I want to remind myself that my patient is up there, not down here. Even if the video of my patient is down here, I want to be looking up at them because I'm trying to customize my approaches to meet them where they're at and give them some of those same senses that we actually have in the clinical office. So therapists are training themselves to look into the camera as if it's the patient's eyes, a hard thing to do in the beginning. We're also learning how to dialogue with a camera. This is what Hollywood actors have to be able to do, and people that do television as a profession. They are supposed to be good and natural at looking into the camera like it's a person, not shrinks like me, but we're training and doing that differently so that we can meet the needs of the folks that we're trying to help. Therapists also had to learn how to deal with a lot of unexpected digital factors. We're not exactly known for being tech gurus in our space. We're the kinds of people that almost have no tech. You walk in, you sit in the lobby, we walk out, we get you. You come sit down in a nice couch in a warmly lit room, and we sit across from each other, and we don't touch technology the entire time we're talking to you. However, we had to become more successful with interacting with our patients despite challenges with technology. Imagine having a conversation with a patient and they're telling you something about a traumatic past event, or they're explaining to you how they've lost the will to live. And in their tears and in their pain, you're starting to hear that dreaded glitch through the sound system, or you're starting to notice that their picture has frozen and they're not moving anymore. How do you adapt to that and roll with that so that you don't break the organic and genuine process that's occurring here, but you still allow these problems to be surmounted and get above them? And how do you, as a trained professional, not lose your cool when all that's going on, not lose your rhythm, not lose your momentum? It's daunting. It's frustrating, especially when you've spent your whole career doing it one way in live space with no possible interruptions. And now you're dependent upon technology. Therapists have had to train these last 9 months in doing it that new way. As we talked about a second ago, 75% of my colleagues are now doing therapy this way, which means we've had to learn how to overcome those frustrations, how to roll with the punches. And that's been vital to the way we connect with folks during a time when there has been a greater mental health crisis among all the nations of the world than ever before since World War II. Getting over that user experience and thinking how your patient is seeing you and trying to interact with them are new skills that we haven't necessarily had the chance to translate into the digital space. Many of you don't know this, but when you go to graduate school, master's or doctoral training in order to become a therapist, you never take a class in anything that even sounds like telehealth. You do not learn those skills. You are constantly learning the way to do therapy that we have been doing it for the last 100 years. But during the COVID era, none of that mattered anymore, so we all had to adapt. In today's talk, the things that I really wanted to bring to you, and I really wanted to make time for some good quality questions as well, so that's coming in just a moment. The things I wanted to bring to you is first to realize that the global pandemic actually increased our sample size of human beings who relate to the Martian experience. They know what it is to be inside of a bubble. They know what it is to feel mortally afraid of what the outside world could do to them. They know what it is to feel bored, to feel frustrated, to feel uncertain about their own futures, and to not know when this is all going to end. And they also know how it feels to have this extended social isolation time of high anxiety and high depression. So with that sample size increased, my profession has had to leave its comfortable box of 100 years of doing our trade and try to do it fundamentally differently. A huge swing from less than 1% of my profession doing this to now 3/4 of my profession doing this. Not one of us experienced in how to do it, not one of us trained in how to do it, and we have spent these last months learning how to do it, so that we can make that difference, so that we can connect with people where they're at. And as I've summarized for you, there's a whole bunch of therapeutic techniques and skills that we have to be able to do in an organic way. When you go talk to a therapist, you're not just getting a worksheet. You're not just getting some mantra or being taught how to do yoga or being taught how to meditate. We're encountering you in your reality. And that dialogue is crucial. And that ability to both have physical, nonverbal communication as well as live communication is something that's very hard to replicate in a digital environment. We're learning how to do that now. I won't say that we've perfected it, but I will point this out. Studies are showing that telehealth adaptation is successful. Patients are reporting that they're finding just as much help from our therapists in this digital landscape as they did back when we did things in the old way of actually meeting in a closed space. So the efficacy is still very high, even as therapists are adapting into a world that they have never trained for and that they have no clue how to do. We're finding a way to be successful, and we're adapting everything that we do. And lastly, there's that issue of technological interface and limitations. Earlier today, we were hearing about the communication problems that are going to exist with Martian explorers. And many of you are probably already wondering that question. I can't wait to open the chat and see some of these unique questions. But I imagine that somebody's going to say, Jim, how is this going to work when there's like a 40-minute delay? How is this going to work when it's like 15 minutes to beam a signal one way and back? Oddly enough, we've actually already begun adapting to the delay problem, because we do have situations where we don't have live communication and latency is an issue. And it turns almost into a therapeutic asynchronous postcard situation where there's a little video postcard of the therapist creating a question and opening a discussion and then getting that to the patient and having the patient ruminate on that, contemplate it, and then send it back. And that's actually turning out to be a very powerful therapeutic intervention. The patient is learning how to adapt their communication style and their sharing and their contemplation to match that asynchronous communication style that sometimes must occur with the technology. So even with latency, even with delays, it's still going to be very viable for us to do something with mental health care in space. So this is the part of the show where I want to kind of turn to the chat and I want to gather some questions and budget some time to really speak to it. But real quick, as you're typing into those questions into the chat, a couple of things. If you'd like to connect with me on Twitter, you can. I'm a Las Vegas therapist, so of course my handle is Sin City Shrink. Feel free to friend me, and I'd love to continue the conversation with other space enthusiasts. You can write to me directly. My email address is right there on the screen, drjimjobin@gmail.com. And again, if you're already part of the Slack interface that's partnering with this conference, which if you haven't done yet, you absolutely should do. You can find it if you go into your Attendify and you go up to the conference information. There's a link in there that says, here's how to get to the Slack. Go ahead and jump into the Slack. And if you look into the channels, you'll find a hashtag that says mental health. Jump in there, continue the conversation with me and with other professionals that are doing psychology at the conference. We want to make sure that those questions are getting answered and that folks are continuing a robust dialogue about all things psychology. I do have two questions to start your conversations over there at that hashtag mental health. I'd be interested in what your thoughts are. How should we be incorporating therapy into our simulations here on Earth? Too often we just put humans away in some kind of shelter in the desert and we just throw our hands up to see what happens. But that's not a true simulation, because we will have the ability to dialogue with these folks. Are we allowing therapists here on Earth to train in these simulations so that they can be helpful to NASA later on in the future? And a second question to stimulate conversation in that hashtag mental health: what do you think your personal biggest challenge would be on a trip to Mars? That helps therapists like me to get into your head and try to imagine from your chair what it would be like if you were traveling across the cosmos and going to a new planet. What would be your challenge? Might it be depression? Might it be anxiety? Maybe it's just loneliness. Maybe it's fear for your family members back home. Maybe your own history and your own trauma can sometimes influence this for yourself. Guys, mental health is an important part of our interplanetary dialogue. It cannot be left behind because at the end of the day, human beings' brains and minds are our most valuable resource when we're talking about interplanetary human spaceflight. And yet, that same brilliant conscious brain is also our greatest vulnerability. When we're talking about flying through interstellar space, all bets are off, guys. We can predict how your blood cells and bone marrow are going to behave. We can't predict what a human mind's going to do. We need these countermeasures to be worked through and practiced by real clinicians. So NASA, if you're listening, send me an email. I'll be happy to be part of your ground crew helping out the Martian pioneers. All right, friends, let's jump into the chat, and I'll invite my volunteer assistant today, Brennan, to let me know what we're seeing in there and see if we can answer any questions for folks.
Well, while everybody's thinking, I actually do have a question.
Sure.
Is there anything that you've found that's been kind of an advantage doing everything remotely as opposed to being in person?
It's a huge advantage. Now, this next part might not apply, perfectly to Martian pioneers, but a lot of people say, "Isn't this less personal, Jim? Isn't this less personal talking to people through a computer screen?" Not at all. I'm meeting human beings in their real habitat. When they used to come see me in the office, they're driving across town, they're walking in an office building, they're putting on nice clothes, and they're sitting on this couch. It's a very sanitized environment. But through this kind of interface, I'm talking to them when their kids are running behind them. I'm talking to nursing mothers who couldn't have otherwise come out to see me. I'm seeing pets jumping up onto their lap. I'm seeing pictures behind them, and they're turning and telling me about their grandmother's urn and who she was to them and what they meant for them. So entering into my patient's actual habitat and environment is hugely successful for the therapeutic relationship and gives me a lot more access to who they are as people as we try to attempt to repair what they're going through.
Great. I have a question here on, is there any meditation skills you think may be helpful with space travel?
I do. So a lot of people are discovering meditation now, and especially a derivative of that called mindfulness. Mindfulness has to do with noticing the emotion that you're experiencing and separating yourself from it a little bit. When that emotion comes, it isn't that I feel anger. It's that anger is present with me. It isn't that I am sad. It's that sadness has arrived in the room. So mindfulness allows us to notice things like anxiety, sadness, anger, or other kinds of emotions. And rather than personalizing it, we're separating from it and we're noticing it. It doesn't affect me. I'm not fighting against it. I allow it to exist in the room. Mindfulness, I think, is going to be an important strategy as our humans are traveling in this very small environment, as they bump elbows and rub shoulders and have miscommunications and get on each other's nerves. I think it's going to be important for them to notice, I'm experiencing irritation right now. Frustration has shown up in my mind. Let me just notice that. Let me just accept that. That form of meditation, what we call mindfulness, is a cognitive trick that allows people not to be swept up in a problem, but rather merely to observe it and not be affected by it.
Great. Question here on if tribalization and how you think that will affect Martian crews.
Say that again, tribalization?
Tribalization, yeah, the whole idea that we kind of self-isolate into smaller groups.
If you listen to today's earlier talk about the chamber experiments, our presenter absolutely identified that as one of the things researchers have seen. Many of you guys know about the Biosphere 2 experiment that happened in the 90s. And one of the reasons that wasn't super duper successful is because the humans turned into little factions. And there was like one tribe that believed in like the purity of the experiment and the other tribe who believed that it was more about the spirit of the experiment. And all of a sudden they were divided. If you look through human history, we are absolutely capable of doing that in almost any situation. And so that's very important because our researcher earlier today talked about some countermeasures that they're doing to create crew homogeny. You know, that way folks feel like they identify with each other, and actually to have good crew compatibility, which is important in the selection process. But as a therapist, I always show up to the scene after there's a problem. So as much as I like our NASA researchers who are going to be doing great experiments to get us a good crew to send up to Mars, we need therapists who are still arriving on the scene who can help whenever there is a problem. So do I think that factions and tribalism are going to show up in our crews? Yes, I think it's kind of inevitable. Can we still work with that as therapists on the ground to try to mitigate those harms and keep our crew at an optimal performance level? Yes, we can still have a mission successful crew, even though those little factions are almost certainly going to arrive.
Okay, the next one, I'm not sure what this is, but will binaural beats help overcome some of the mental health issues en route to Mars? Maybe explain a little bit what a binaural beat is as well for those of us that don't know.
Yeah, I'm curious as to what the question asker is referring to there. That could mean multiple things. I'm wondering if they're talking about prescription medicines, or I'm wondering if they're talking about audio therapy when they say beats. I almost wonder if that's what the reference is to. So I'm not sure that I could speak to that without more information.
Clarification of binaural.
Oh, binaural beats. Okay. The beats part is throwing me off, but you know, it sounds like what they're throwing in there is it possible to interact directly with human neurology? That is possible. And last year in 2019 at the same conference, there was a colleague who presented on some countermeasures for mental illness for our folks that are in space flight and folks that are on Mars. And they talked about some really interesting interventions, things like art therapy and psychodrama. I'm all for that. But the problem is that here in the planet Earth, I've got tons of folks who don't do their homework as it is. The most therapeutic encounter they have is actually with me and me trying to use all of my trained in skills to make a difference. So as much as I think we can equip our astronauts and Martians with interventions that might help them in flight and once they're actually in Mars, I don't trust them to do it, because humans who are in distress don't tend to do those things. They just sit and pout and get angry and stew. And so we kind of need that external factor of the therapist to interact via talk therapy and hopefully get a difference in the person.
Yeah, that makes sense. Should astronauts be trained in mental health? And do you think that would lessen the need for therapists back on Earth if that was the case?
In a perfect world, I'd want to shrink going with them. But I think every discipline will say that, right? If you asked a plumber, the plumber would say, "You're going to need a plumber on that flight. Pick me," right? It's always that way. Everybody thinks that their trade should be up there. And yeah, I do think that one of the most effective things we could do would be to send somebody who's extensively trained. See, we have no question that we should be sending a doctor. Everybody says definitely send a physician. But it seems to me silly, because if you're sending a medical doctor who has advanced training in like diagnostics, that's not much more effective than a field medic. You just need somebody who can do tourniquets and basic first aid and a little bit of medium level, medical discipline to help. That's the basic training. There's not a heck of a lot more than a medical doctor and all their years of schooling is going to bring to the situation that mission control couldn't have figured out for themselves. On the other hand, a therapist has a lifetime and career of training in that human interaction, constantly monitoring for signs and weaknesses in other human beings, and hopefully having the techniques to ameliorate that live in real time. So NASA, if you're listening, send a shrink. Space shrink needs to go on this mission. And you know what? You can ask me about it. I'll have to ask my kids if they're cool with it. I don't think they'll let Papa go for 3 years, but I think you need to be sending a shrink on the mission too. So yes, questioner, that would absolutely make a big difference. At a minimum, mental health first aid. At a
Yeah,
minimum, we need every single astronaut to be trained in basic mental health first aid.
yeah, that makes sense. So we know you're not a researcher, but do you have any kind of ideas or hypotheses on what might specifically learn from the COVID isolation in relation to space travel?
Yes, those studies are still ongoing, right? And so here's one of the things that I think is really problematic. We're really good at studying how human beings' bodies work when they're in space long term. And then, other than that, we have to ask them to share with us how their minds are, how their emotions are, how their interpersonal relationships are going. And astronauts are not super duper well known for being like upfront about that kind of stuff. Arguably, it's not good for their career. And our presenter this morning talked about that among cosmonauts. There's a temptation to not volunteer for these kinds of psych experiments because they want to be seen as this, like, flawless hero. And that's going to be a problem because these folks, I'm not worried about their heart rate when they're in space. I'm worried about their mind. And if they are in depression or anxiety or there's factions, they are now mission suboptimal. And that's not going to work for us here on the ground. So the question asker is saying, hey, do you think this pandemic is going to teach us even more about space? I really do. I really do, because it's whether the astronauts want to admit it or not, this is continuing to confirm what social isolation does to people, what constant mortal uncertainty does to people, and what it's like to be dependent upon technology to interact. It's not just teaching us bad things, it's teaching us good things. And it's teaching us that countermeasures, such as digital therapy, actually can work in this unique environment, which is a lesson we dang well need to take with us into space.
Yeah, I think that's the last question we'll have time for. But so, how do you deal with the privacy issue? So, proper therapy requires honesty, and in many scenarios, mission control could be listening in on the conversation, or depending on tight spaces, it could be easy for fellow astronauts to hear in to what you're saying. So, any thoughts on dealing with that?
Great question. Great question. And you know what? As I've been meditating on this, and my colleagues and I are starting to think about how to help Martian pioneers, this is one of the most important questions. They're going to be enclosed in a space not much bigger than a van. How do you have an intimate conversation with your therapist when everybody's around you? Soundproof helmet. That's what I want somebody to invent. I want the soundproof helmet that allows air supply, has a VR headset, and that way people can have private conversations, not just with the therapist, but with mission control, with family members talking to their kids. And so they can sit in the corner and just Velcro themselves in there, put on that helmet, click it on, breathe freely, speak naturally, and other people can't hear anything besides the gentle hum of their throat making noises. That's what I want. So if there's any engineers out there who are studying audiology, invent that for me, because I really believe that would make a big difference.
Okay, great. Thank you for your time. I think that's probably about all we have time for before the next session starts.
Great, everybody. Thanks so much for inviting me. I'm honored to get to share this time with you. And feel free to reach out. Go to #mentalhealth on the Slack, email me or tweet to me. I'd love to be friends.
All right. Thank you very much.